3 passengers are dead. A British crew member urgently needs medical care. The CDC has declared a Level 3 emergency response. And passengers from the infected cruise ship MV Hondius are already home, scattered across 5 American states before most people even knew there was an outbreak. Tonight, the world is asking hard questions about how a deadly hantavirus outbreak was allowed to disperse globally before authorities even knew what they were dealing with. Joining me now are Sophia Reeves, our economics and markets editor, and James Chen, our geopolitical analyst. Sophia, let me start with you. Is the international health system fundamentally broken? Or are we looking at an outbreak that has actually been managed reasonably well?
Thanks, Emma. Look, let's be honest about what managed reasonably well means in this context. 3 people are dead, passengers are spread across 5 states with no guarantee they weren't exposed, and the WHO's opening response was essentially, "Don't panic, this isn't COVID." That is not reassurance. That is institutional damage control. The WHO's credibility on early outbreak management has been in tatters since 2020, when they spent the critical early weeks of COVID deferring to Beijing rather than protecting the world. Now they're telling us hantavirus spreads differently, and we should all calm down. They're probably right on the science, but probably right isn't good enough when you're talking about a pathogen with a case fatality rate of 30 to 40%. What this outbreak reveals is that sovereign national governments, the CDC, the UK Health Security Agency, Argentine health authorities, were essentially reactive. They were waiting for information to filter through an international system that moves at the speed of diplomacy, not the speed of a virus. And the uncomfortable truth is that passengers were already home in Texas and California before anyone declared a Level 3 emergency.
But Sophia, isn't that precisely what the monitoring system is designed to handle? The passengers are being watched, none are showing symptoms, and the WHO is right that hantavirus doesn't spread person to person the way COVID does. Isn't this actually the system working? And James, what's your take on this?
Well, look, I think Sophia is making an important point about institutional speed, but I'd push back on the framing. Here's what the data actually shows. Hantavirus pulmonary syndrome has a horrific fatality rate, yes, but it requires direct contact with infected rodent material to transmit in almost every documented case. The exception, and this is critical, is the Andes strain, which circulates in Argentina and which has shown limited human-to-human transmission in rare documented instances. So the question isn't just, is the WHO reassuring us correctly? The question is, do we know which strain this is? Do we know the precise exposure pathway? Argentina is the world's highest incidence country for hantavirus by WHO metrics. The ship departed from Argentina. These aren't coincidences. They're data points that should have triggered faster screening protocols the moment anyone presented with symptoms on board. What I'd argue is that the system isn't broken, but the speed of the system's decision-making is. And in public health, speed is everything.
I hear what James is saying, but with respect, that misses the point entirely. Yes, in an ideal world, we'd have perfect information about the strain before making decisions. But governments don't have the luxury of waiting for complete epidemiological data. They have to act on incomplete information in real time. 7 people confirmed or suspected infected, 3 dead, a case fatality rate north of 30%, and passengers were allowed to disperse internationally? Come on. If this were a terror threat with those parameters, 7 suspected cases, 30% lethality, you'd have borders locked down within hours. But because it's a virus, because it requires deference to the WHO, because nobody wants to be accused of overreacting, governments sat on their hands. That's the failure. It's not the science, it's the political will. And I'm sorry, but right now the political will in international health governance is determined by who can avoid embarrassing the institution, not who can protect the public fastest.
Here's what I want to know. Argentina is at the center of this investigation, and they haven't confirmed the exposure source yet. If they can't pin it down, what does that mean for the people currently being monitored in Texas, Georgia, Virginia, Arizona, and California? James, where do you see this going?
The way I see this playing out, if Argentina establishes a clear point source exposure on land, a specific location where rodent contact occurred during shore activities, then this closes relatively cleanly. The monitored passengers ride out their surveillance window, remain asymptomatic, and the international health system breathes a collective sigh of relief. But if Argentina can't establish that point source, then the trajectory suggests a prolonged period of uncertainty that is genuinely dangerous. Not because hantavirus is about to become a pandemic, it almost certainly isn't, but because unexplained outbreak origins create the conditions for poor policy responses. You get overcorrection in some areas and underreaction in others. And in those gaps, people get hurt. Watch for Argentina's investigative timeline. If they haven't confirmed a source within the next 2 weeks, the questions get significantly harder.
Here's what concerns me most. It's not the immediate outbreak, it's the precedent. Expedition cruises to Antarctica are a booming industry. They operate in remote locations, they interact with local environments that have genuinely elevated pathogen risks, and then they return hundreds of passengers to international travel hubs. If the international community takes away from this, that the system basically worked, they will not implement the tougher pre-departure screening and post-voyage surveillance protocols that are clearly needed. The risk here is institutional complacency. 3 people died on one ship. The next expedition might carry more passengers. The next strain might have different transmission dynamics. What history tells us is that the window between contained event and preventable catastrophe is often only as wide as the lessons governments actually learn and actually implement.
Sophia Reeves, James Chen, a sobering conversation. One thing is certain, somewhere in the Argentine Health Ministry tonight there's a scientist who knows that the world is waiting for their answer, and that whatever they find may either close this story permanently or blow it wide open.